this is an esophageal cancer, and this is the esophagus in the middle of the tract that connects the mouth to the stomach. This is a case that presented to us in Emirates Hospital in the middle of Dubai Healthcare City. It was referred from a major tertiary hospital in Abu Dhabi, without mentioning names, huge hospital. The patient has esophageal cancer. It was diagnosed, difficulty swallowing, and needed an operation to remove this cancer from his esophagus. If you look at this picture, this is the heart. This is the major vessels coming out of the heart. This is the esophagus, and this is the spine. And the esophagus is in a very deep part of your thoracic chest cavity. It's in the middle. So the first thing, you have the skin, you have the trachea, the windpipe, and then you have the major vessels coming out of your heart. Behind all of this is your esophagus. Behind all of this is the aorta, the major vessel, and then the spine. It's associated, this operation is associated with high risk, complicated complications. That starts with a long list. There's few of the things that can happen when you remove an esophagus, and the main thing here is actually death. So when we do an operation like that, we have frank discussion with our patient that you have a serious chance of dying from this operation. This was described in 1944 by the father of all esophageal surgery who attempted performing this. He calls it inaccessible, like you guys have seen in the picture. It's in a very deep place in the chest. It's dangerous and rapid deterioration of the patient in case of any problems. It's a formidable undertaking, and it's suturing the unsuturable. The esophagus is very thin, like you're suturing tissue paper. Before going to this slide, I keep on, when we discuss what kind of operations are performed in Dubai and in these major hospitals we have, our visitors who come to us from all around the world, the United States, UK, Germany, Ireland, Canada, the first thing they ask, what are the complicated operations you perform in these 5-star beautiful hospitals? Because that represents the depth of your hospital. It represents the integration of all the teams that working in your hospital, starting from your nursing staff, to your intensive care, to anesthesia, to your physiotherapist, to your lab that's looking into the specimen, and that gives the result when the patient goes home, performing these complex operations. People who do this operation are called general thoracic surgeons. So this is the intersection between general surgery and cardiothoracic surgery. We perform operations in the neck, the chest cavity, and the upper GI system. We're familiar with operations of the lung, the trachea, the esophagus, the stomach. We perform cancer surgery, and we perform benign surgery for reflux and obesity. So it's the stomach all the way up to the mandible. This is an operation that's not related to esophagus, but one of the operations that's performed in Dubai for a patient with a huge mass in his neck. Open chest. It's a picture which is a bit difficult to see, but this kind of operations represent what your team can perform in a hospital. This is an interesting slide. According to the databases we have in North America, they look at each operation and they rate it to its complexity and risk. So they say this operation has a risk of 30%, 40%, 20% when we talk about patient mortality, death and complication. And this is the real number that when people look at your system, look at your hospital, is what are you guys capable of doing? Esophagectomy is number one out of all the cases performed. Still high complex, followed by pancreatic surgery. Esophagectomy takes a high risk. What we do in this operation is that we remove the esophagus, but this is the picture with all the other organs that I showed you earlier. So we remove the esophagus, There's no connection now between the esophagus and the stomach. We cut the stomach like a tube, like when you're doing a sleeve gastrectomy for weight loss surgery. We make the stomach like a tube, and we take it up to suture it here. We stitch it here. Okay. This is the traditional way of performing an esophagectomy. Open procedure. You open the abdomen, you remove the tumor, you perform, this is the conduit, you prepare the stomach like a tube, you open the chest, this is the lung, and then you remove the esophagus, this is the tumor, and then you perform a hand-saw anastomosis. Open surgery, and this is how we used to do it a few years ago. It's not easy, but it's an open procedure. So you open the chest, you open the abdomen, you have good access, but the patient has difficulty recovering. Getting out of hospital is longer. There's so much pain associated with this kind of operation. It's difficult to breathe. There's more complications because it's huge field. You've opened two places. You've opened the abdomen and if you open the chest. This is a good book. I recommend anyone who's in the field of medicine to read it. It's not only good for a surgeon, but it's good to anyone. We have an obligation to perform better, to do what's better for our patients. And if we try to do this every day, we'll sleep and try to do it again the same way the next day in the morning. And this brings us to the concept of this talk is minimally invasive esophagectomy. Performing this operation through 4 small cuts in the chest and 5 small cuts in the abdomen. Instead of this big cut in the abdomen and the big cut in the chest. Same operation. We're removing the tumor. There's a space between the esophagus and the stomach. We're cutting the stomach into a tube and then we're stitching it into the esophagus. This is where I was before moving back to Dubai about 4 years ago and introducing the concept of minimally